Imagine that under the control of an X-ray or CT image, through a tiny puncture in the skin, a thin needle is inserted directly into the problematic intervertebral disc. Laser energy is delivered through this needle. This energy has a pinpoint effect on the nucleus pulposus of the disc, causing it to partially vaporize. As a result, intradiscal pressure decreases and the protrusion decreases, freeing the pinched nerve roots and eliminating pain. The advantages of this method are impressive: no large incisions, minimal risk of bleeding and infection. Often the procedure is performed on an outpatient basis, and the patient can return home the same day or the next morning. Due to minimal intervention, the recovery period is much shorter than after traditional open surgery. The procedure is performed under visual control, which allows the doctor to act with jeweler's precision. Another important feature of Dr. Zorin's work is the performance of operations under the control of a spiral computed tomography scanner. This significantly increases the safety and effectiveness of the intervention. CT navigation allows the doctor to see the position of the instruments inside the spine in real time, avoiding damage to nerve structures and other important tissues. It is important to understand that the doctor approaches the treatment of protrusions comprehensively. He is not limited to surgical methods. At the initial consultation, he carefully studies the patient's medical history, conducts an examination, analyzes the results of MRI and other examinations. Based on this information, an individual treatment plan is developed, which may include conservative treatment, drug therapy, painkillers, anti-inflammatory drugs, muscle relaxants, physiotherapy, physical therapy, blockades. These methods can be effective in the initial stages of protrusion or as preparation for minimally invasive intervention. Minimally invasive surgical methods: laser vaporization, radiofrequency ablation, microdiscectomy, if necessary, removal of a herniated disc through a small incision. Rehabilitation after any type of treatment. A properly selected rehabilitation program plays an important role, aimed at restoring spinal function, strengthening back muscles and preventing relapses. The approach is distinguished by individualization and the desire to use the most modern and least traumatic methods to achieve the best results in the treatment of intervertebral disc protrusions. The use of advanced technologies makes the doctor one of the leading specialists in this field in Ukraine.